Agenda item. We have Dr. Erin Haynes of the University of Kentucky. She's going to share results for the health tracking study. And that is it.
You ready? Great. So it's hard to know which way to face. I want to do both you and this group. I did not bring slides, but I do have handouts, so you can see I have some you can share. You may have to share. And then I have this one, and we'll get to that in just a second. Actually, can I have one back? I'm going to need a cheat sheet. Just one. Thanks. All right, my name is Erin Haynes with an N. I know my husband gave me a name that everybody screws up. Still love it. Still love him. I am an environmental health scientist, but I'm from Appalachia. I grew up in rural Ohio, in Adams, then Brown, and Claremont County, just along the river. And all of my work has been focused on Appalachian, Ohio, and issues that residents face, whether it be the hazardous waste incinerator in East Liverpool or the ferromanganese refinery in Marietta. And hydraulic fracturing came to our attention, compressor stations, which has forced me to do a lot of pivoting and not just focus on one chemical. So when the derailment occurred over a year ago, that was the hugest pivot, seeing all of the potential chemicals, things that I had never studied before, made it a necessity. And my heart was with you as soon as we saw the flames and the burning. Dolores Silverthorne lives in Rogers, and she's been working with me on many of these studies for now over 2 decades with the studies, but East Liverpool for like 15 years. So one of the first things we decided to do, and my heart has been with you since the beginning, and I have honestly not stopped thinking every day about this community and what science, what data, things that I could help and bring to the table. So one of the first things we did was to launch a survey to start tracking health symptoms over time. That was very important, that you could document your experiences and the symptoms that you had immediately after and then long term. There may be symptoms, people may be great right now, and who knows what happens later. There's a possibility that has occurred before in other disaster scenarios. So we want to set something up that is long-term for tracking. So we created a logo, created the survey very briefly, and this is a summary of not all of the data, but these are like the highlights. So I wanted to have everyone in the community take this. Now, that did not happen, of course. We only had 380 actually go through and take enough of the questions that we can say they participated. Some people signed in, and then I think they just wanted to see what we were asking, and they got out. So we struck them from the group. But over half of them live within 2 miles of the derailment. So the majority of the people live in your community right here. I think that's important. And I summarized with bullets the key pieces that we're noticing. And we're working to get this published, peer-reviewed scientific literature, but that takes time, and I'm really honored and glad to be able to share it with you before the years it might take. I don't know how long pubs take, but it's more important to me that you know this information and can start working with it than it is in the scientific literature. So out of everyone in the survey, 3 out of every 4 reported experiencing at least one new health symptom since the derailment occurred. That's quite a few people. And over half of those indicated that those symptoms were upper respiratory, which completely follows what we would expect from the chemicals that came from the burning, and the fire from the derailment. Over 80%, this is, I think, very interesting, live within 1 mile. So I did not bring the map of the data, but I'd be glad to share it if you're interested. We are working on it as a publication. The concentration of new symptoms being upper respiratory is much higher, 80% within a mile. And then that number goes out to about 50% at 5+ miles. So it's a nice grade of symptoms for upper respiratory. So although it's not everyone in the community, I feel good about the responses that we are getting valid data. So, all right, I'm going to keep going and then I'll tell you next steps. We are following, so that we did a second survey and over half of them said that their symptoms were still persistent. They still remained in the fall. So we're going to do it again in February, and my hope, we expect to see them declining. That's the intention. That's what anticipated. We'll see. We looked and screened for stress. These are actual measures that screen. There's, scientifically validated questions to assess individuals' level of stress. And stress was very high, and it continued through the fall. And so did post-traumatic stress disorder screening. I think that's a really big one. That it's not a diagnostic PTSD, but it's a screener. And a third of them had those symptoms. So your community needs more than a hug. You do need that, but you also need to take mental health very seriously and take resources that are available to you. I would really encourage that for everyone. We did ask questions about bottled water and drinking, and half in the fall still said they relied on bottled water. So I thought that was interesting that there was still concern about drinking water. And odors were still remaining. So we continue to follow. We're going to look at long-term tracking these data, and more importantly, I really want to expand this out to have more people. So we're going to start and launch it again. We're going to do a version 2.0, and we've been discussing ways to encourage people to do this survey, and not just those who are experiencing a symptom, but even those who aren't, so that we have everybody in this project. And the longer that we will keep everyone in this group, call it a cohort, so that we can follow and look long-term at anything related to liver function or kidney disease. We really want to track you. So there's lots of studies that have tracked people over time, like the Nurses' Health Study. I don't know if you've heard of that one, but it's a national study, and they tracked nurses, and they followed them. They thought, who would be the best at taking surveys? Nurses. So nurses have been followed, thousands of them over time, and they've looked at where they live and their chemicals and what products they use, and then later life cancer and mental health, etc. So we're kind of following that model, and we truly want to capture as many people as we can. So I hope to announce the launch, we're not ready yet, of this survey 2.0, the second one, and enable a broad, hopefully more people, and maybe after, we'll say, the dust has settled and it's a little quieter, more people will be interested and inclined to take this. So I could pause and say if you have any questions on this part, I'd be glad to answer them, or I can move on to some other fun stuff that we did. Yes?
Would we be reaching out to the folks that participated the first time around, or
Yep.
would we have to reapply to?
Oh yeah, those who are in are in. And we got you unless you say, hey, stop, stop calling me. But we will always try to reach you. And then now we just want more people. Great question.
So you said 380 were
Yep.
in this.
Yep.
How many did you kick out? How many did you?
It was over. I was getting excited. Over 400. That was sounding better. But there were some who answered maybe one or didn't answer any. And if we didn't have enough information, we had to draw a line and say, that's really not a participant.
So you bottomed out at 380.
Yeah, that's our
And
That's
no
our current
smokers
number.
can be in your program, right?
Oh no, we'll take anyone. We love smokers. Bring them on.
I'm a smoker.
Bring smoker, anyone. Actually the eligibility was anyone. We didn't want to just limit it to the 1 mile or the 2 mile. We did all of Columbiana County. And then we said any county surrounding Columbiana County. Anyone.
See, I'm Beaver County.
Great.
Chippewa.
Erin. You're eligible. And if you're 18 and over, and then that's it. Live in one of those counties that are over 18. We had to limit, having a child do a survey takes parents, and then there's more complications. And I love children's studies, but for this, it was a little complex. But we are asking questions about kids and how are they responding. And I hope that would be a great study another day. But this information is really important to start saying, okay, where are the key things that need to be further addressed to identify research tracks.
I have one more question. You did the blood test.
Yeah.
Okay, we know you're going to talk about that.
Yes.
And then, are you doing any testing with the liver? Like, can you test the liver for dioxins or no?
No, you can do, I'll talk about the blood. Yes, I'll give you that. But there are liver, like you can have your blood drawn, and like a normal clinical test would measure a liver function. There are tools for that. And if you asked your physician to have your liver function tested, they could easily do that. And if you want advice on what exactly to ask for, we'd be glad to give that to you.
Dioxins, then
If you
can ask that. Okay.
Dioxin is, all right, you ready for the blood? I think that's a segue. All right, so this one's a two-parter. So I'm going to ask that you carefully count the pages and just take two. I have this, and then there's an example. Okay. All right, this has not been shared before. You guys are getting something new. We have not published it. I'm working on it. Very few media outlets. I've shared it because it's like I wanted to bring it back to this group and before the world. This is your data. So there were so many questions about dioxin and any other chemicals in the derailment. Can you measure them in the body? And it was, okay, we can help. I don't know how to, let's figure this out. How can we do this? So dioxins form when burning occurs. So forest fires create dioxin. Burning trash creates dioxins. There's also industrial sources. It's when there's carbon in the air and then chlorine. And wow, did you have a perfect scenario to create dioxins in your air. So it was very scary. It was like perfect storm. So it was, we must measure dioxin in the community. It was like, that was one of the top priorities. So I knew EPA was doing soil, so I didn't, waste money. You don't want to redo what somebody else is doing. The best laboratory is in the U.S. is the Centers for Disease Control, the CDC. They have the standard methods. I reached out to them, and they were absolutely wonderful and said, yes, we will do your samples for free. They did this, which is great. We invited 20 of our participants to do the pilot. We collected blood and urine, and I'll tell you about urine in a moment, but we collected the blood. Participants had to give 4 tubes of whole blood to have 1 measure of serum, enough serum to analyze for dioxin. That was a lot. So is that a typical measure you ask your doctor for? No. They don't even know really where to send the samples to. God love them. But what do they do with it? How do they collect it? Do they use the right equipment? It's very technical. It took our team months to go through the protocol, learn the method, and be able to do this. So we're ready now, but it took time. So the CDC had the samples, they analyzed them, we got the data back, and for that study, I didn't want smoking to interfere at all. So we took smokers out of the equation. So only invited non-smokers, those who were within a mile, because I thought, let's invite those who, if there was dioxin enough that we would see it, it would be those who are close. So close to the derailment, non-smokers, and then obviously they were over 18. And we wanted to have a nice mix of males and females, because there's a difference. All right. So I gave you, I think this summary has a lot of information about what they are, how people are exposed to them. I just wanted you to have it because it helps to make sense of what dioxins are and how you get exposed. Everyone in America has a dioxin level in their body. We've all been exposed. And normally right now we get that from eating high-fat foods, meat, eggs, some fish. And so it's in our body no matter what. We've got it. And the way we analyzed it or gave the data back were, because there's 20 of these dioxins that we measured. And so you can have all of them summed up into one value that you can then compare to others in the U.S. So we summed them all up. It's called a toxic equivalent value, TEQ. I'm glad I have my little cheat sheet. It's the TEQ, and we could compare that to a large group in the U.S. have had their dioxins measured, and we could compare in 2010, 2011 that had been done, and it's called the Erin Haynes study. No relation. And we found, and I have that second page as an example of what we gave back to one person. But I'm happy to say, and I was very relieved, a little surprised actually, but relieved to see that everyone in all 20, actually there were only 18 that we had enough blood for, so 18 of them, were within or below the comparison value of the United States. Yay! What a relief. It was a surprise, but a very good surprise.
And you say they were the folks close
Yes.
to ground zero?
They were within a mile, and they were non-smokers. Yep. And they had dioxin, but no more. They were within the range of typical U.S. or somewhere below. So it does not mean, I want to make sure we translate this right. My guess is there was, you would almost certain chemistry, there were probably dioxins in the air, but was it enough to to have it? It was not enough to make it any different than typical in the U.S. So a few things that I want to do next with this is that we compared it to 2010, 2011. That's the only data we had. That's over a decade old. We think dioxin levels should be decreasing over time. So as soon as the Erin Haynes, as soon as CDC publishes their next data, we're going to grab it and we're going to compare and see how it compares to more contemporary values. So, and then we'll come back and write everybody a new letter. Hopefully it stays the same, we'll just see. All right, any questions on the dioxin? I thought that was really big and important to do.
If I missed, when was the blood?
Yeah, I did not input that on there. I didn't put it on this either. We measured in July 17, 18, 19, somewhere in that time frame. Mid-July. That's when we collected. Good question. So would that have been enough time? Yeah, probably. Now, should we do it on more people? We could. This was a pilot. This was let's try 20 and see. We actually had enough for 18, but that we could do more. But I was really glad to see that there wasn't anything alarming at this point for dioxin.
And will you test that same 18 6 months later? 18?
We could. Yep. So these normally they charge you. They were good about letting us doing this without cost. So money, but we can, it could be done. Or I wonder, should we do the same again, or should we or do more people? Maybe people who didn't evacuate and stayed. Who knows? Or maybe by a certain geography where maybe some levels in soil were higher than others, just to rule it out. I think if that's a question, we need to rule it out. We need to answer it with data. I love doing that. Any other on the blood dioxin?
Were
Yes.
there any people from the fire department tested?
Not in our pilot. We, on the survey, we asked them, were you part of the emergency response? Were you a first responder? I don't think any of them joined our survey. So let me make that a call out. We would love to have the first responders. And when I was thinking, how can we, how can we help? What population? Of course, the first responders were like top of the list. But I heard there was a study, and that was kind of like taken care of. Like a group was going to work on them. So I've heard. I don't know how that's going, but okay. Anyway, no, to answer your question. Okay. Anything else on the blood dioxin? I'm trying to move relatively quick, but also make sure I cover it well. All right, we also collected urine, and that's always, well, we didn't. They did it themselves. Self-collection. And the goal of the urine was all of the other chemicals. So there was vinyl chloride in the air, there were the acrylates, and there were people going to LabCorp and having their vinyl chloride tested. And I was seeing it in the news, and I was reading the newspapers, and the message was, I have it in my body, what do I do? And it was like, what are they? And for me, I was like, what is that lab measuring? Because there's not, to our knowledge, there is no good measure of these chemicals metabolizing and then measuring it in your urine. So whenever you inhale or exposed to chemicals, they are processed, just like your food. Chemicals are processed, and those little processed pieces are called metabolites. So when you urinate, you have lots of metabolites in your body. Drug screen, for instance, that's an easy one. Those are metabolites of chemicals. Cotinine you can see if someone's a smoker or if your kids smoke. Random urine test. But you can measure those metabolites in urine. So there is currently no off-the-shelf method for analyzing any of these metabolites. And I think that was the reason that the state, the feds, did not collect and analyze, because the method wasn't readily available. But that didn't sit with me, research. Well, let's find one. And there's a lab at Wayne State. You have friends in other places. And Wayne State in Detroit, she's a wonderful chemist. Her name's Judy Westrick. And she said, I'm going to do this. I can figure this out, and her team. So they have been working on figuring out the best metabolites for vinyl chloride, acrolein, acrylates, etc. I don't have that data to share because we sent it in, she had a lab person, that lab person then left her lab. So then she had someone else pick it up who's now done it twice, and now this is number 4th time, and I hope this one works. So she's developing them, and as soon as we have that data, I would love to share it with you. So because it's really important. And again, they were collected in July. And because these are new methods, we reached out I mentioned that I work in Marietta, Ohio, and we had a call out for them, would you give urine so we can compare to East Palestine residents? And they volunteered and did that. So we have Marietta also as a comparison for you to see what the differences are. So I'm excited to look at that when we have it. Okay, that's the urine. There's not a lot of excitement, data, but it's a process.
Different group than the 18 for the blood?
Same. But we had more urine because everybody could give a sample there. In Marietta, there was one gal who couldn't. I was like, drink more. Nope. Anyway.
So, just to
Yes,
clarify,
please, Trent. Yes.
all these people to get on national television, say how horrible our town is and all this, and say that they have vinyl chloride in their urine. It's impossible for them to know whether it's vinyl chloride in their urine or anything, because there is no actual test to test any vinyl chloride.
So let me address that one. I wish I had, so there's a pathway of metabolites for vinyl chloride. And one of them at the very end of the pathway was the one that LabCorp is measuring. Now, unfortunately, this chemical can also be found from other exposures. It's not specific to vinyl chloride. Is it from vinyl chloride? It could be, but it could also have been from other things. Darn it. So if a survey had been given to those individuals at the time of collection that helped to rule out other things, that would have been great. But to my knowledge, that wasn't done.
And my second question is, there's a lot of talk about dioxins, that they do these tests.
Yeah.
And one group does them and they're within normal range, and the other group does them and they're 39,463 times higher than that. Those dioxins may be in the ground, but as far as your study,
Yeah.
that you don't see any rise in human dioxin levels in this town from the people you studied. I know it's not everybody.
Yeah.
Okay.
So,
Thank you.
yeah, we did not see anything. We saw dioxin in the body. We saw it. But it was within the U.S. typical range.
Thank you.
Yes.
Appreciate it.
Linda.
I have a question. Some of these people with the respiratory issues and that sort of
Yes.
thing were self-reported.
Yeah. All of them,
Was-
yep.
Was there any baseline?
Oh.
Like, for example, if they'd seen an allergist or
Yeah.
pulmonologist, or if they're seeing one
Yeah.
now. So was there any way to medically
Yeah.
help those people and identify that this has been there
Yep.
or this is new?
That's a very good question, and we grappled with that. Like, you weren't studied baseline. Not everyone, no one had a pulmonary function test the week before the derailment. You didn't have your dioxin measured the week before the derailment. Unfortunately, we don't have that. But we phrased the question in a way, it was all caps, new, N-E-W. Do you have any new symptoms? So, and we are also asking a medical history. And we hope to see any of those new symptoms decrease.
The reason I'm asking is a lot of people in the
Yeah.
in the surrounding area
Yeah.
see an allergist on a fairly routine basis. So we're just asking
Yeah.
so that we know what we're, not saying people are having issues, but what are we looking at and how do people get?
Yeah.
If that's the case.
Yes, and we do want people to get help. We asked the question in such a way that it was new. You know, I'm not taking their survey, but that we tried to phrase it in a way that it wasn't your normal asthma, anything new.
But it was self-reported.
All of it was the survey is 100% self-report. Is that the best? No, it's better to go to a physician and have them, or a healthcare provider, and have them actually give a lung function test. And I wish everyone should have had a lung function test, or be followed to see if there was lung impacts, and then do they get better? Do they get worse? You know, what's the outcome? But I recommend lung function testing.
As to your 18 people that went through the dioxin
Yep.
process, several of those people have indicated to me that they are very interested in going to the next step, just because they thought it was great to have a baseline.
Yeah.
They were pleased with their results, but they plan to do a follow-up, so hopefully they will see you and make
I hope we can have the funds to do another follow-up, to do that. I think that would be excellent, and to do more people. I have one more piece of information to share, if time allows, and that we did some air sampling, indoor air. I know it's been another. So anytime there's a hot topic or a question, I know EPA has their thing and they're doing it, but they're not filling all the questions that I'm hearing. So indoor air was important, right? That's at least what I heard. And so we figured out, let's do something. So we recruited a different group of people to place it's a little badge, a VOC badge, in their home for a whole week, and it would measure all VOCs. So it's a start. It's something that's normally used in an occupational setting. So someone at a work location where there might be exposures, and then they could either test it on them as an individual or in their workspace. So we use these in residences, and I've not shared the data back with the individuals yet, and I need to, but I'm encouraged to share it with you here because I'm here. It took 5 hours to get here. I might as well give it to you. So we analyzed them for, and this is again, we sent them to that wonderful colleague at Wayne State, Judy Westrick. She analyzed them for the acrylates, and then BTEX, which is commonly found in gasoline. They are just typical VOCs, typically from like diesel, or you would, at a gas station, you're gonna have BTEX exposure. You can smell it, right? That sweet smell. My daughter loved it. Ugh. I'm like, stop breathing it. Get back in the car. And then the lab was able to do solvents. So they threw those in as a bonus. So I was most interested in the 2 acrylates that were related to the derailment. And I'm very, I can give you the summary. None of the homes that we had them in for a week, and this was in the fall, I believe September. Misty, thank you. It was in September. None of the homes had acrylates. I thought that was very good. There were 2 homes out of the 15 that we did that had levels that were uncommonly high for BTEX, which meant there's some sort of gasoline exposure in their household. So I'm gonna do some phone calls with them and try to investigate that a little bit. It could be that, and so these chemicals, BTEX, they can cause dizziness, headache, rashes, and there was a lot of truck traffic going on. And during an when you're leaving your home, and if a home is closed, the air stays in, and then it can raise the levels of any, it just circulates indoors, it stays. But when your house is open, the windows, it flows more, and the air's better indoors. So one of the homes we know they had evacuated and had returned about a month before we sampled, and they had the highest value. So it makes me just question. There's lots of things it could be a gas tank or something, but benzene wasn't high, but just one of those BTEX measures. So it makes me wonder if it was because the house was closed, or what was it? So I'm still investigating that piece, and I think we should probably do more with indoor air, just because there were 2 of the 15 that had unusual BTEX that shouldn't be in a house. Not typically in every home has some BTEX. You're going to get a measure, but not at these levels. So I do want to go back. And we're going to offer them to have a second test with us, just to see if it's changed since September. But I wanted to give you the no acrylates in the air of those homes, which is good.
One other thing I'd like to clarify.
Okay, bring it.
You are totally independent. You work for the village, right? Please explain how you're doing this to help our community.
Yeah.
You really didn't work with anybody.
No.
Village administration, you worked with Misty, we thank you for that. But I just want to clarify that you're on either side. You're totally independent. So.
Yeah, my funding, I came into it, I think I tried to reach out. Dolores knew your mom or hairdresser or something. I was like,
I apologize.
Your mom.
She knew a mom.
My mom at that time, and I got yelled at for that too.
I thought I had it in. I was like, okay, I am not funded by the village or EP. Nobody funds me except, I use my own money and the university. When you move, I'm in Ohio, so I was in Cincinnati. I went to Kentucky, they gave you a startup package. I used some of that. But I also applied. We have an internal source, but it's from NIEHS. They have a center. So we have a great environmental health sciences center at UK. I'm now the interim director of that center, but I applied to a pilot, and it was $50,000. So it's helping to cover the cost of our travel here and the analysis and accept the dioxin. So that's been great. And that was just for 1 year.
I just want to add to that too. I was pulling on Erin's heartstrings, I'm not gonna lie. I was sending her pictures from my house of the clouds and everything that was going on, so.
I just want to clarify that because everybody says, oh, no, that's because you're with NS or you're.
Oh, I'm not
Heritage,
with-
or You're with
no.
somebody. I just want to clarify that you are totally independent.
Yeah, we've never met. I'm not.
That's the first time we're meeting.
Yes.
Can you speak to the silicone wristbands?
Oh, yeah. So we did those also, we did so many things, and I'm like, when I look back and think of all the items, but there were so many questions, and I don't feel like it was enough. I feel like the community needed more than what we did. But another thing that we did, there's a lab at Duke University that can analyze. They clean them first, so that's a cleaned sample, but like the Livestrong wristbands, silicone wristbands. So they clean them, they send them to me, and then we asked residents, about 85 people who are in our survey, to wear them for a week. And they wore the wristband, and they are still at Duke being analyzed. But because Judy's lab was doing all these super fun things with acrylates and vinyl chloride and stuff, we asked, hey, can you cut the wristband? Do you need all of it, Duke? And they said, no, we don't need all of it. So they're cutting the wristband. Half of it's going to go to Wayne State. So we get more out of that data. So I don't have that yet, but I will bring that to you as soon as we get it. And that includes measures of PFAS and PAHs, so any burning chemicals would be there. They've used them on firefighters before, which is cool. So I have that as a comparison. Now the day, you know how research goes. It's never perfect. It's never perfect. But the day we got the wristbands, we got them on everyone. Everyone signed a consent form. We wake up the next morning, and it's all cloudy. The wildfire smoke coming from Canada that day. It's like, great. Well, it became a wildfire study that day on our wristbands. We will see wildfire smoke on that wristband. That'll be interesting. But maybe we'll see other things. I'm looking forward to that data. That was all that we've done so far. Yes. Hi.
This is a big one. How about the potential synergistic impact of compound chemical?
Yeah, I ask that question all the time, even in our work. Like so you weren't exposed to just one thing. Clearly not. Many chemicals in the environment. Our tests can do some things in urine, some things in blood, and then being able to put it all together is really important. And I have had residents inform me about, like, all right, how to give the data back. And if it wasn't for the community advice, we wouldn't have these beautiful blood dioxin result letters. Because I had feedback on how to write those from the locals, what would make sense, what wouldn't. But to answer that question, it's very challenging to put it all together. But the advice was, let's just wait until you have all of the information and then we can present it as one. But that urine was taking way too long. It was just dragging on, and I thought, let's just get this out. You need it soon. It's a great question. Science is still trying to catch up to what we all know is good.
There's very little testing of chemical combinations.
Yeah. And that's
the zero.
Yep, and it's very hard to statistically analyze that.
Right.
Because they all have different, every time you measure in a different body part of your, whether hair, toenails, blood, anything, teeth, I've collected all of these on people, and someone's like, well, can't you put it all together? Like, what does it mean? Just because it's in your tooth, how does that compare to your hair? I don't know. So these are all great questions, and we have societies and science, and people are trying to look into it, but we don't have it yet as a field, as a science. Good question, though. Yeah.
Now, you say you'd like to expand your study, but
Yes.
there's no money?
I'll
So
talk
what you
about
gotta do
money.
now, the state and the federal government says,
Yeah.
what can we do to help? Well,
Yes.
pony up.
That would be great. Just so this group knows, I don't know if you've been aware, but the National Institute of Environmental Health Sciences, the one that I do have a pilot from our center through, They're one of the institutes of NIH. So NIEHS is planning to fund multiple research studies beyond myself. So there will be an announcement shortly about who and what they're going to do. The encouragement is that they all collaborate. So you're not randomly hit by investigators and you don't know what to do. I really want to make sure it's harmonized.
I have a question.
Yeah.
Getting back to, you had mentioned the urine study again.
Yes.
With the polyvinyl chlorides in the urine, could there be a link? I know your one report had said that there was a increase in bottled water consumption than
Yeah.
there was previously. Could the microplastics from the bottles themselves have any impact on that?
So for the vinyl chloride metabolite, I don't think so, but that's a good question. That's
One
a good.
One of the things is with these bottles sitting out in the sun all the time,
Yeah.
you're going to get some chemical leaching
Mm-hmm.
from the bottle itself. I'm just wondering if that has any impact on the study.
We can certainly. It's hard with the population of, 20 that we have, but we do know who's drinking bottled water and who's not. But if that's the case, don't we all drink bottled water and Pepsi and sodas? Yeah.
Right.
There's other chemicals in the plastic too that come out. So, but I still do it. I mean, it's just so darn common. I wish we didn't have the bottles, but part of our life.
Will you be available for questions after?
Absolutely. I'm sure you want to move on.
Well, we have another presentation too.
Great.
I greatly appreciate you making the drive up here.
I'm happy to. Thank you very much for letting me come, and I'd be glad to come back and give you more as we get it.
Thank you very much. We appreciate it. All right, next we have the NS and the EPA cleanup status update and future projects.
Thank you. So hello everybody, I've got some slides here, but a lot of the slides are on these posters here, so maybe you guys can see these while they can see those. We'll play it by ear. But my name's Andy Maguire. I'm with the US EPA Region 5. A lot of you probably don't know my name. You're probably expecting Mark Durno because he's talked to you all a lot over the course of this last year. I've been here quite a bit, however, but my role is more of direct oversight of Norfolk Southern, doing operations out in the field. So if you see me around town, I'm usually got a hard hat and a yellow vest on. So we're going to talk today about mainly the results of a qualitative, what we call a qualitative sheen survey that we did last November in Sulphur and Leslie Run. And then after we talk about that, we're going to talk about some upcoming work that we're going to do in the creeks to clean up, do some more cleanup in the creeks. So forgive me here while I get my slides up. All right. All right, showing up. So this slide here, y'all can't see it, but it's pretty generic. It just shows the spill pathway from the derailment, right? It's just pinpointing on a map where the derailment happened, how the contamination ran along the ditches into Sulphur Run, and then beyond down into Leslie Run. And what we did, you can see it on it kind of mirrors the maps that you see on the boards. The sheen survey was done every 25 feet. So each little point there that that looks like they're all stacked together, it's actually individual points about 25 feet apart. And every 25 feet, we went in and agitated the sediment to see if a sheen popped up, a discoloration or a sheen of the water. You can see on the map on the far left there, it's all sheen observations. So you can see there was plenty of sheen that we found along the creeks. The photo on the left is how we scored the sheen, right? So there's various types of sheen. There could have been no sheen. There could have been a light sheen. And when we're done, you can get up, or if you want to get up and take a look at the photos a little closer, you can see kind of generically how we scored them between light sheen, no sheen, light sheen, what we called medium sheen, or heavy sheen. And this, you can see all sheen, the next, and there's the photos for you guys so you can see. So you can kind of see, and the boards, you can see it a lot better. So after the meeting, you can take a look. But this is just kind of how we scored it, right? As we went out there and did our agitation and our survey. So the next board to your right, it's where we did not see any sheen. So those were locations along the creeks and the waterways where we did not see any sheen. And this is the same thing that's over there. Next is where we saw medium sheen. So you could see, or was that light sheen? My bad. Whoops. Anyway, so light sheen is here. So we saw a lot of light sheen, right? And the kind of the general progress is where there was more light sheen than there was medium sheen. There was more medium sheen than there was heavy sheen. So this is where we saw our medium sheen along the waterway. And then, Chris, you want to take that one off? And then these are the locations where we saw heavy sheen. So you could see, as you would imagine, in November, several months after the derailment, the sheen was, we saw more light sheen than we did heavy sheen in November. We put some bar graphs or some, circle graphs up here. You can see them on the photos there. Just marks out overall what our sheen count was, right? For the over 800 points that we took. You could see it up close a little bit more, but you could see it, there's much more heavy sheen, or much less heavy sheen than there was light sheen. And this one is just for Sulphur Run with the counts and Leslie Run. We also did background, so we went upstream of where the contamination went into the creeks and tested that as well. And I know you can't see this, but there was only 4 locations in those background upstream locations that we saw just light sheen. We didn't see any medium sheen or any heavy sheen. Most of it was no sheen. This, we don't have a board for this, but this is just a location of where we sampled the sheen. So some of those locations we actually took samples to analyze what's in the sheen, right? You mentioned BTEX, right? That's something we're looking for, or the acrylates, the vinyl chloride, other things that were released as part of the derailment. So one thing that just came out today, and there's no board for this, is a public viewer where you can actually go online and look at that assessment that we did. It's going to look a little different than these maps here. There's some privacy concerns, right? A lot of these the creek bed is public or private property, so we took some liberties and kind of generalized it a little bit. But you can still go into different sections of the creeks and see where the sheen was identified. And I think we're going to probably get this link in our newsletter that I think should be coming out this week. So the link will be on that. The link's here. It's long, so you probably you might be able to write it down. I did try Googling it before I came here, and Google doesn't know it's there yet. So just look for it in the newsletter, and I'm sure, we'll try.
Yeah, I was going to ask, can you share with us?
Yeah, we'll share with you. We'll certainly get the link out and make sure it's in the newsletters this week. But again, it'll just be more interactive. There'll be some good information on there to help you walk through the viewer. There's photos as well. You can scroll through photos on the viewer as well. All right, so that was our qualitative assessment of the sheen. Any questions on that? Yeah.
Wasn't this information the same thing was put on the EPA's mailing a while back that said sheen? And you gave generalization of percentage.
Yeah, so there's been some sheen assessments done throughout the project. I'm highlighting one where we did it in a much more granular fashion, where we did it every 25 feet. But yes, there has been, information put out in the newsletters throughout the derailment that highlighted some of where we saw sheen.
Now, not to seem silly or stupid about it, how did you do the sheen assessment? Did you go downstream and work your way
Yes.
back up? Because if you start poking holes,
Yep.
next thing you know, it's going to keep on going down.
You're exactly right. We went downstream and worked our way up. Yep.
So the downstream would have been less obvious, and as you went upstream more, then you have more of a chance of seeing sheen or problems.
Yeah. Yeah. Any other questions before I move on to the cleanup?
Can
Yep.
you describe how you did the agitation? Did you just stick a stick in and just move it around? Did you get on 6 inches or?
No, it's a shovel or a pole, and you just kind of work look for sheen. Down at Leslie Run, there's a lot of rocks, and a lot of the sheen can get caught underneath the rocks. So kicking up rocks, things like that, trying to liberate the sheen as we're looking for it. And while we're doing this, immediately downstream, we have containment, right? We don't want to let the sheen continue on downstream. So as we're doing it, we're also containing and collecting any sheen that might pop up. Any other questions on the survey? Yep.
Did any of the folks who were performing this work have any health impacts? I mean, we hear stories of creek rangers out there poking around in there, and then they suffer for a good bit of time afterwards. Did you find any of that with the folks who were performing this study?
We did not. We also had air monitoring going on while they were in the creeks, testing to make sure the air was okay. But no, to answer your question, no, nothing. Chris, did you ever hear anything? Yeah.
Not wearing breathing apparatus or any PPE?
Not for this, no.
We have had no one wearing that since February of last year.
Yeah. Yeah, yes, sir.
Is there any way to tell whether this is a legacy issue or whether it's
Possibly. That was not part of this, though. We're not trying to determine if it was legacy or derailment related for this qualitative. But we took samples, right? And actually, we're continuing to take samples to help try and identify if it potentially is legacy or not. Yeah.
How does this sheen vary from sheens in parking lots? I've been up at the Boardman Mall, and it's been raining. There's puddles with sheen in it.
Right.
How is that varied?
It's hard to say. I mean, petroleum sheen in general, right, can be kind of a rainbow, right? That's probably what you're seeing in a parking lot. It can be like that. We've seen that. It also tends to, as it breaks up, come back together, right? Because there's biological sheen too, from decomposing leaves that are in the water, things like that. It acts differently. And so we have experts out here when they do the sheen to help determine if it's a petroleum oil sheen or like a biological sheen. So, and it may or may not, be rainbow. It could be, dark in color too. It could depend on what type of oil it is, right? So yeah, but there's experts out there who are trained to know what the sheen looks like, to make sure it's not a biological sheen, just from a, natural decomposition of organic matter, or something like that. Any other questions on the sheen before I move to upcoming cleanup work? Yeah.
Do you have any results as yet to the samples that you took of those areas that you extracted that soil? Is that still being?
So there are some results out there. I'm not prepared to talk about exactly what and where, but there are some results out there.
Are those going to be released to the public?
Yeah, they may already be. I'm not 100% sure. But yeah, certainly they'll be released to the public. Yeah. Yeah.
I got a call from EPA today because I had questioned them for months ago, and they said that they posted and they gave me, I think they gave me that link.
Did they give you the link already?
They're supposed to be out, you're supposed to be able to check everywhere they tested, what they said. I can't
Yeah.
say, I'm not gonna.
Yeah, and it may not be in a viewer like this, easily to digest. It might be in like a report, unfortunately. We have a lot of data out there, and it's in various formats, you know what I mean? So it may, this was set up strictly to look at the sheen, but there's likely, it's probably in some report, unfortunately, out there that's, buried somewhere else. But any other sheen before I move to the upcoming cleanup work? All right. So as part of this sheen survey, right, we developed a work plan, where we're still developing a work plan, finalizing a work plan to go to some of these areas, right, where we're seeing the mediums, the heavy sheens, right, and go take some action to clean it up, right? And, as we talk about we'll get into what we're gonna do, I just wanted to touch on some of and you guys can't see this, I apologize, but I'll read through it. Talk about some of the previous work, right, that has happened over the last year. One of the things we've done to clean up the creeks over the past year is a couple different rounds of what we call flushing the creeks. And what that is, it's a use of a low pressure, high volume amounts of water, right? Just to try and mobilize some of the contamination that's stuck under maybe rocks or, debris that's in the creeks. And then again, we have that containment just immediately downstream as we, release the contamination from where it's stuck to capture it downstream so it doesn't go any further. So that's one thing that's been done a few times over the course of the last year. Also done another thing called air knifing. And what that is, it's, using a pole with compressed air, sticking it into the sediments of the creek to try and again mobilize that contamination and collect it immediately downstream. So that was done twice, 3 times?
Several times.
Yeah. Last summer was mainly when that happened, last summer. And again, you ask about exposure, right? We're doing air monitoring. So we do air monitoring whenever we're doing any of these activities down in the creek. We've got air monitoring going on to make sure the workers and the public. We also have, when we're doing these activities, we have air monitoring outside of the creek in the neighborhoods to make sure that if it's, creating an air issue, we're going to know, right? And be able to stop work or report out if there's an issue. And then another thing we did in late 2023 last year was culvert sediment removal. So the various culverts that Sulphur Run crosses through town, right? We're sitting on one right now. We're on top of one right now. Actually went into not all of them, most of them, from the derailment site down, and just removed all the sediment from out of the culverts. Didn't do the washing. I mean, there was washing done over time through the culverts, but this operation was to just remove the sediments and debris from the culverts. I'll mention one, and it's going to be mentioned in the upcoming work. It's the longest culvert through town. Kind of goes there from the James crossing at the main lines over to, just behind the Family Assistance Center. It kind of crosses Taggart right there. There were some health and safety concerns with that long stretch of culvert to do the full removal, but we're going to revisit it, right? We're going to try and, put our heads together, figure out a safe way to do some of the removal of the sediments in that culvert in the upcoming work. All right, so again, you can't read this, but I'll read through, or you can't see this in the back, but I'll read through it. This is our upcoming work. So I mentioned it's based on that stream assessment I went through, that sheen assessment I went through. We're going to target areas with that medium and heavy sheen, and as well as that 800-foot long culvert. We're going to evaluate other tactics. I mentioned washing, air knifing, right? We're going to, after doing a couple rounds of that over the last year, we're going to evaluate other things to do. Maybe excavation, right? Using shovels, things like that. We're going to evaluate those areas probably with the heavy sheens and see if there's another thing we can do to help, clean out that contamination. the locations are going to be evaluated site specifically, right? So we know where the heavy sheen is. We're going to go to those locations. We're going to bring experts, stakeholders like Ohio EPA, and come evaluate it together and come up with a tactic to remove the contamination. So like I said, it could be a litany of different things, but we're going to focus on those areas and come up on a site-specific tactic to get rid of the contamination. After we're done, after we do a round of cleanup, we're going to go back and do another sheen assessment, right? We're going to do the same thing we did before, see if it worked, right? Make sure we got it all. And if we didn't, we'll do the same thing again. We'll just keep doing it until we can get that creek cleaned out. And again, anything we do in there, we'll have containment immediately downstream and make sure we're collecting it so it doesn't go further downstream. So I think that's all I have. Questions on cleanup
Now,
or anything?
would this be funded by state EPA or federal EPA?
So it's funded by Norfolk Southern.
Oh, okay, very good.
But we do direct oversight. Ohio EPA, US EPA, we're there every step of the way. Like I said, we're evaluating, we're helping what tactic to pick, right? What we think will work, all that. But it's all funded by Norfolk Southern. Any other questions on cleanup?
I have a question.
Yeah.
What, with all the assessments and checking and everything, what impact has this had on the aquatic flora and fauna in the streams themselves?
Well, I'm going to look at Bill Zawiski, our friendly Ohio EPA stream expert, and maybe he can expand on that.
Sure. So, we've done a couple of biologic surveys, like we talked about. In 2022, we did a complete survey of Little Beaver Creek, so we have as fresh of information as we will. In 2023, a biologic survey was done of the flow path. So the map you folks couldn't see, but the flow path down into Little Beaver Creek, biologic stations were done there. What we know, and this is the amazing thing, is 2022, Leslie Run was meeting Ohio EPA's biologic standards. Sulphur Run has been so impacted by what we're the culverting that it doesn't have biologic expectations because that's not fair for that creek. But we'll go, there was a complete fish kill in the spill. So we're gonna say, without even arguing, everything that was a fish in that creek was dead. In 6 months, it scored higher than it did in 2022. That's a testament to Mother Nature's resilience and the fact that had we done this in 1985, this creek, Leslie, was on par with the Cuyahoga and the Mahoning River in the worst of that's how bad this stream was impacted. That it could recover that quickly is amazing. The site we wanted to do the most was the one immediately downstream where the bridge was replaced this summer, and when they dropped that bridge, they screwed up everything for us to do a biologic survey. The bugs, we do fish and bugs. The bugs we did at Negley, because again, we couldn't get downstream, and it scored higher than it did in 2022. So I'm pretty comfortable that biologically we have complete recovery. We're doing biology again this year just to confirm that that's the trend. So there you have it.
And one of the, I didn't mention one of the potential tactics, right? I talked about we're all going to meet at these different locations and come up with a cleanup tactic. Well, at some point, we're going to have folks like Bill there to tell us, yeah, I don't want you doing anything here because it's going to cause more of an environmental impact than cleaning out the sheen, right? So that's part of it. That's a potential tactic we can use. Is doing an evaluation. Are we doing more harm than good? And then that would turn into what we call a monitored natural attenuation of the contamination. So, yeah. So I mean that's why we're all there together, all the heads, stakeholders, experts, cleanup experts, deciding what to do on site-specific basis. Because there's areas of Leslie Run where, yeah, we don't want to. It's looking healthy. We don't want to make it worse. by doing some sort of, aggressive removal tactic or something like that in the creek. So, yeah.
Do you imagine that the reason that it bounced back so well is because of cleanup efforts that might have washed out contaminants from before the derailment as well, or is there some sort of explanation for that?
Yeah, I think there's a great explanation. One, Mother Nature's resilient, and two, in spite of everything that happened, the creek viewed this as a spill. This was an event that within a day or two was contained as far as the discharge. So this was a discrete event, and that the streams are able to respond to that. And if we go back to the 80s, where every day there were discharges from Sulphur Run from the wastewater plant pounding on that stream, it never had the chance to recover. So this was an event, and it was able to recover, and that's why. It was contained and controlled.
Anything else? Any other questions? All right.
So I had.
Dr. Erin Haynes, Andy, Bill, you guys are tough acts to follow. So I'm Chris Hunsicker. I'm with Norfolk Southern Railroad from the environmental operations. I'm leading the environmental cleanup here. So I know there was a question you guys want to know, next steps, where we are, and I was going to talk about that a little bit here. A lot of things are happening, a lot of next steps are happening, but what we're talking about right now is a real positive one. It's a real good one in the process and the progress of the site here. When the event happened, we had the incident very early on. We made the decision we are collecting all the water that's flowing across the site. We had the spill, it went downstream. The areas that could have been affected, we were handling all that water. So anything that rained on our site, the areas around our site, we were collecting all that water and managing it. As we're managing that water, because of the incident, we were treating all that water as a hazardous waste. It was a listed hazardous waste. So everything we collected, regardless of whether it was impacted or not, because we didn't know, we're saying, hey, all this stuff's hazardous. All right, we're going to manage it that way. And that we've been doing that since, March last year, so a long time now. As our sites progressed along, we've cleaned up a lot of areas. Most of the soil areas, they're all dug out. All the areas where we're expecting contamination, we've dug all that out. So we're not seeing areas where that stormwater could flow into the ditches where we're collecting that water and have it come back as hazardous. We're just not seeing that data. So for the past 5 months or so, the water that we collect, and we analyze it all the time to know what we have here, we're not seeing hazardous constituents in it. We've got over 80 sample results from that data where we collect it, and we're not seeing hazardous waste in that. So we wouldn't classify that as a hazardous waste. So all this water, we still collect, we still manage. It's in the big blue tanks, it's the frac tanks down there. Right now, we're handling it as hazardous waste, or we're running it through that treatment plant up there. Once we treat it, we test it again, make sure that water is good. If we feel that's comfortable, we submit it to OEPA, they review it, you guys have a part of it too, and say, hey, you know what, we can, based on what we've done, we no longer need to manage this batch as a hazardous waste, all right? Been doing that for a while, the 5 months, 80 tests. We've been doing that long enough that we are no longer seeing anything that indicates this is a hazardous waste. So we're not quite there yet, but it's gonna happen pretty soon. We're in the process of working with the agencies, develop our plan, develop our system of how we're going to start managing the water that we collect as a non-hazardous waste. We're still going to take it off-site. There may be occasional hazardous waste shipments based on decon water and things like that with the regs. We're still going to handle all this water, take it off-site to a licensed disposal facility, for approval for disposal, but it won't be a non-haz waste. So soon, we're hoping, we'll still collect the batch of water. We'll still test it to confirm it's going to be non-hazardous. We're not going to presume anything. We'll collect it and presume, we'll collect it, test it, demonstrate it's not hazardous, go to the regulator and say, hey, here's our package, here's our data that confirms it's not hazardous, and then we'll be able to ship that to a non-hazardous facility. What this does for us is, there's a lot of benefits here. It speeds up the process of removal and managing waste on the site, because right now, if we have to treat it or handle it, manage as hazardous waste, it limits where we can go with it. if we can get this in a point where we're handling everything as non-hazardous, it opens up other disposal facilities, which are all licensed, permitted in Ohio and in other states, that they can handle this material. So we can get things out of the site faster. That helps shrink the site. We can get things more back to normal. If we can handle it as a non-hazardous waste, it is less trucks that we need to run on the north side of the site up by, Brave Industries and Martin. We can get all these trucks that will go out from the south side of our site and just go out on the highway. They don't go through town. We can get them to a disposal facility. So we're not driving past people's homes with, with hazardous waste trucks. If it's non-hazardous, we can have more trucks available to us. We can have more drivers available to us. And again, more disposal facilities that are available to us to get the materials out. And the goal with all this, again, is all the water that we collect, we still have to manage, and we're still disposing right now. It's in the process. We're hoping we evolve to other stages, but that's where we are now. That helps us shrink our storage, what we have on site. With that storage, we can have less storage tanks. We can start shrinking their auxiliary facilities so we can break things in, shrink the site, get the village and community back to where it was before. So that's kind of where we are in our progress on the handling of water. So I know I talk quickly. I'm not excited at just, talking about it. And I said a lot. Questions, comments, anything you guys want to hear more about? Yes, sir.
You were saying about the excavation out at the accident site being complete. Was there, what was the indications of pollution prior to the accident? I mean, was you guys cleaning up? Because I know that area, I believe, once was a heavy equipment boneyard and stuff. Was you guys finding stuff, I'm sure, that had nothing to do with the accident? Do you know any of that?
We do know there's an industrial history from the village, from the town. We're seeing but anything related to anything we saw related to the derailment based on the chemicals that we're looking for, the constituents. If we saw that, we dug that out until we reached the cleanup requirements that were laid out in all our plans. Anything else?
Nope. Thank you, sir.
That was easy. All right. Thank you, guys.